Don't do anything in your life where you're going to be unhappy. If you are unhappy, I am unhappy. I wish somebody had told me these things when I was applying.
Today, we have an interview with Dr. Khillan, who is an assistant professor of medicine at State University of New York Medical Center. He has more than 10 years of experience in teaching medical students from America and all over the world. He's a medical oncologist, and he runs a medical center, which is called Brooklyn Cancer Center in New York. Hello, Dr. Khillan.
Hi, Iuliia.
Thank you for agreeing to participate in this interview. All the community of IMGs will be very pleased to listen to your opinion regarding the match season and everything that is connected to it. So I have a couple of questions for you. All of these questions will be connected to the current situations with the COVID-19 and match season 2021. And my first question is, how do you think, should international medical graduates apply for the match this season? Because a lot of people think that there are a lot of malignant conditions which may influence the rate of IMG's match in this season. So how do you think, will it affect the rate of IMGs in programs, and how will program directors review these applicants because of the situations with the virus?
Sure. So, Iuliia, I'm going to divide your question. It's a long question in like 3 parts.
Yes.
So, number one, I think the main question is, will America need doctors or not? Right?
Yeah.
Yes, America will need doctors because in America, population is aging. There are more people who need doctors. And there are around 34 to 35,000 spots, residency spots in the United States, only for medicine. Out of that, we have around 17 to 18,000 medical students, right? So we always need 17,000. How are we going to create that, right? So we get it from international medical students. So we get it from different parts of the world. Now, with COVID, will need for medicine or need for doctors will go down? I don't think so. Actually, need will go up. So there's going to be more need of doctors. And we have only those 17 to 18,000 medical students. We need to fill out those spots. So second question you asked me is, what is going on in program director's mind at this position, right?
Yeah.
Like what if a program director he's thinking only one thing. He needs to fill his spots. He has 10, 15, 20, 30, 40 spots. He needs to fill it. Mm-hmm. Whether he's at Johns Hopkins, whether he's in a small hospital, community hospital in Brooklyn, they have to fill their spots. So the big hospitals, big university hospitals, they get American graduates very easily. They will get it. But in America, they don't want to monotonize this thing. That's the best part about America. Diversity, everybody want to get some sort of competition. They don't want to just focus on US students. They always look for talent. That's why this country is number one. They look for talent all over the world. And wherever they find it, they get it. All right. Now, for a small program, the program director may think this, okay, this is a student who I'm interviewing, who's in Belarus, right? Or who's in India. Now, he can think this, that, okay, I'm interviewing this guy on Zoom who's in India, and I have another student who's in Chicago, USA, who's able to come here. So he will, I think this year, give preference to the person who's in Chicago, sitting here, instead of who's sitting in Belarus, because I think he will think that if you cannot come here for an interview, how will you come here to start the residency, right? So that will be on program director's mind this year because of this COVID situation. So what I think is the best thing to do is, during your interview, I think people should be in US. Even if you do your Zoom meeting, that's fine. Most of the interview is going to be on the computer. But I think it will be a psychological effect on the program director's mind if you are here in US. instead of, anywhere in the country. Because what is happening this year also, there were so many people who were not able to travel because of the restrictions. They give them July off. They give them July vacation. They were not able to come. Now they are trying to, fill out those positions. So they're running around. Nobody wants that, right? No program director wants to do it. So I think the best strategy for a student at this point should be, first of all, seats are there, okay? Don't be discouraged that, seats will go down. Seats are, they are fixed. They need doctors. They need those 17,000 spots. They need to fill those. Now, who they're gonna take? That's the important point, right? So who are these lucky 17,000 international medical graduates they're gonna take? So they're gonna try to take people who have secured their visas, who have green cards, or who are present in United States, at least for interview, So that's what I think. I don't think so there is anything gonna happen to the requirement, because there are spots and very few medical students, only 17,000. We have 35,000 spots, so we have to fill those.
Okay, thank you. So I have one question related to your answer. So, for example, if you had two candidates, the first one is with no visa, however, he has high scores, fresh year of graduation, and good research, and the other candidate, he has visa or green card, however, he has a pure amount of research and maybe some red flags. Whom would you prefer this year?
Right. So if you have a program where program director thinks, I'm going to take students from 230 to 250, right? So that's the first filter. So all the people who have between 230 to 250, they will pick them, right? Irrespective of visa or no visa. If a program give a visa, when they are picking that applicants, they're going to pick all of those candidates who have scored between 230 and 250. That will be first filter, right? Now, the second filter is when they're going to interview that person. Now, you said red flag. So let me tell you what is a big red flag. Big red flag is if you fail a step. If you fail a step, that's a big red flag. Nobody's going to get interviewed. So we have to just leave that alone, especially for IMG. I'm sorry to say that. It's very difficult to get it if you fail a step. You have to be here in US, you have to do research, you have to do work in the hospitals, you have to do like 100, maybe 1,000% extra effort. I have seen people getting it, but very difficult. But if everything is okay in that aspect, so if you have a person who has a green card, who has scores of 235, let's take two candidates with the same characteristics, right? 235, 235, green card or US citizen, versus an IMG who need a J1 or H1. And the guy who has 235, he does not have any, of course, if he has green card, he will have some clinical experience. Of course, everybody needs that. And the other person also has clinical experience, whether with tele or somehow. I mean, everybody wants to see the effort. Doesn't matter if you cannot come here, but you did tele, you did effort. That's what program director is looking for. They're looking for your effort. At that point, they're going to prefer that green card candidate, right? If they have exactly same scores, of course, no doubt about it, green card or citizen. But if you have a candidate who had 250 plus, who need a visa, and you are competing with somebody who has 235, then they will pick the candidate who has 250. That's for sure, no doubt about that. And if you come in range of 255, 260, 270, you are gold. Doesn't matter your IMG, doesn't matter your US, you're gold. 270, even in one step, you put it your application, you will get calls from all the university hospitals. Let me tell you that. So scores are very, very important, but especially for IMGs, because a program director, when they're looking for applicants, right, they don't have anything else to see. If you are an American student, yes, we can see which school they're coming from. We know what school is. Now, for me, I don't know how many medical schools are in Russia and what is their rating, how good they are. I don't know. But I know in US, how is John Hopkins? How is Boston University? How is UCLA? So I know those universities. And when I'm interviewing, at SUNY Downstate for these candidates, if somebody's coming from John Hopkins, of course I'm going to prefer him, even if scores are low. But for a foreign graduate, I don't know that. I don't know if Indian school is better, Russian school is better, or Belarusian school is better, or Ecuadorian school is better. I don't know. So what I'm going to see, I'm going to look at your score first. Right? Oh, this guy scored like 270, man. That must be a very smart guy, right? So first thing is you're going to get interview. And second thing is, it covers everything. You just have that score. You do 2-3 months of clinical experience. You know the system. That's it. But if equal scores, they will prefer green card.
Okay, you said that the most important thing is our scores. As we all understand, a lot of IMGs were not able to gain USCE this year because of COVID-19 and all the visa restrictions and travel restrictions. So how would you describe the value of telerotations, and how dramatic will be the lack of clinical experience in the US, such as observership and electives, which are in-person ones? Could you please characterize the value of telerotations and just review your thoughts regarding the lack of clinical experience?
Okay, so about rotations, all the hospitals in the US, they have suspended their clinical programs for the whole 2020 and 2021. It's canceled. Nobody is doing it because we don't know what is happening with this virus, how it's going to go. So that was like one of the easiest thing for them to say, okay, you know what? These students who come from outside, just ban them for now, because that is not something necessary, right? It's not essential. So there are a lot of students who are not getting it. Before, Mount Sinai Hospital, John Hopkins, Harvard, all these places were offering it. Nobody's offering. 2020 is they're not offering, 2021 not offering. Now, institute, they don't do effort. They're not going to do effort. John Hopkins is not going to think, oh, there's a student, Iuliia, in Russia who want to rotate with us. Gee, she cannot. So let's do a tally for her. They're not going to do it, right? Why? They don't need it. They don't need Iuliia at this point. They may need Iuliia later on when you're applying to them, but right now they don't. So, but when you apply, right? That's the worst part in US. They know that you don't have it, right?
Yeah.
So they will tell you, you don't have it, it was difficult, you don't need it. But if they get 2 applicants, one who did it and one who didn't, they will take the one who did.
What do you think is most important, the scores and research and fresh year of graduation, or the presence of USCE at this year?
Number one, score. Okay. Nothing can beat scores. Nothing can beat score. That's number one. Number two, I don't know about year of graduation that much. I think if you are within 5 years and you are okay, maybe if you're really, really old, they do. But in my programs, I have seen these guys who are like 10 years old. They have done an MD, they have done MRCP. These program directors love them, because these guys, they know everything. Like if somebody has done MD from India, that guy, like you don't need to teach him at all. I mean, they know everything, how to manage. So program directors, they like that. But there may be something like maybe 10 years, if you're like older than 10 years, then I think that may be a negative point. So number one is score. Number two is clinical experience, some kind, clinical experience, or what I will say, know the culture here. How that helps is when you go for an interview. If you go to an interview as a stranger, as a foreigner, you have no idea what this thing is. So you cannot connect with the program director. So if you have seen a little bit of New York, little bit of Chicago, little bit of Los Angeles, their teams, you know their baseball teams, who's LeBron James, who is, John McCain. So you have something to talk about, right? Yeah. So when you come for an interview, when I interview, I try not to ask any medical questions. I never ask medical questions because you have done that. I have your transcript in my hand. You have done step 1, step 2, step 3. I don't want to ask you questions. I want to see your personality. I want to see if you adjust to my program. I want to see if you will be happy in my program. I don't want you to be unhappy also, because if you are unhappy, I am unhappy, because you're going to keep complaining for the 3 years. So, not only I want to be happy, I want my residents to be happy too. Because some of the programs which are not very good, they don't want to take too many good residents, because they will not be satisfied. They will not be happy there. So they will keep complaining whole 3 years. And then, what are you going to do? If you have a community program, you cannot get fellowship. You cannot do research. There's I'm very honest. I work in 2 hospitals, Kingsbrook Jewish Medical Center and SUNY Downstate.
Mhm.
SUNY Downstate is a fellowship program. It's a university hospital. Almost every fellowship we have. Kingsbrook community program, no fellowship, nothing. So you're not going to get fellowship. I mean, you will. You may get like nephrology, ID, those like low, those low priority fellowships from Kingsbrook. But if you really want to do cardiology, you really want to do GI, you really want to do HEMOC, Downstate is the place, right? So there is no, I cannot compare both those things. They are apple and oranges. So if somebody comes in and tells me during the interview, oh, I want to do a fellowship, I tell them, you should go to a university hospital or a hospital which has fellowship, because your chance of getting fellowship here is almost zero. And you're going to be so unhappy, in your life. And don't do anything in your life where you're going to be unhappy. You should not do it.
That's a good advice, actually. And doctor, could you please compare the value of telerotations and in-person rotation this year? Because I have just finished telerotation in your hospital, and I was very satisfied. And actually, we gained a lot of experience, and we saw a lot of patients, and we really learned a lot. And it seemed like a real clinical experience. Can you characterize how the PD will probably value these telerotations, and what do they think of it?
Right. So, Iuliia, when you do a rotation, program director wants to know, he does not care where you did it.
Mm-hmm.
He wants to know how well you did it, how much effort you put in that. So
Mm-hmm.
as you said, you did 1 month with me, right? And you were involved, you know the cases. If you go for an interview, if a program director asks you how you did it, what cases will you have any problem telling them? No, right? You can easily tell them, you saw this patient, that patient. You're not making up stuff. You are telling them the truth. On the other hand, if somebody did a real, came here, did a real rotation with a doctor who didn't see patients, didn't come, he did rotation just for LOR. People do that. They just do rotation just to get an LOR. And then he go for an interview, and a program director is asking questions. Okay, what did you do in that rotation? And you say, okay, I saw this patient, but you don't know. Listen, these program directors, they are doing this job from 20 to 30 years. They know how to get truth from you guys. They will know if Iuliia did a rotation or not. They will know that Iuliia spent whole night up by seeing patients here. And they will know somebody X and XYZ went to his cousin's little clinic, and maybe once a month or twice a month, and got a letter. They know. So main thing is effort. How much effort you put in, and how much you can present that, what you learned from that interview. And it depends on candidate to candidate. Like I can guarantee you, like if you go for an interview and they ask you did a cancer rotation. Now there's another thing also, when you go for an interview, most of your questions actually comes from you guys. We don't come prepared for questions. So how question come? You're going to go for an interview, like, okay, did you work in US? You're going to say, yes, I did a tele rotation with Dr. Khillan. Oh, okay, what kind of doctor is he? He's a HEMOC doctor. Okay, so you saw cancer patients? Yes, all right. So what kind of cancer patient you saw? Most common. Okay, so here you go. So you say breast cancer or this cancer. So to prepare for an interview is so easy. You are the one who's going to actually tell the director or the doctor or whoever interviewing you what to ask. You're going to give them all the information. And if you don't have anything, and if you are a blank slate, then we know you didn't do anything in that rotation. Doesn't matter, it's a tele rotation and it's a clinical rotation. It's just that whatever effort you put, we know how to judge that.
Okay, so thank you, doctor. So actually, it's important how we describe it, how we are involved into the process, and how we show it during the interview, right? So it's sometimes more important than the rotation itself, right? So how
Absolutely.
how much information do we learn from that and stuff like that? Okay, that's actually
What you learn, so not only what you learn,
what you did.
also what you present, how you present it. That's also very important.
Yeah, okay. Okay, thank you. I have one more question regarding the personal statement. So a lot of students were not able to gain USCE and had some problems during gaining the certificate and stuff like that. Do you think they should write it in their personal statement, or they should avoid this topic because it's like sounds like complaining of something, and they should rather focus on some good things they did and stuff like that? So do you think it's reasonable to mention COVID-19 in our personal statements or not?
Okay, listen. Personal statement is not what documents you have, what certificates you have. Personal statement is who you are. Who's Julia? That's personal statement. I don't care if Julia did step 1, step 2, or she just did step 1, or she did CS. I don't care. Your personal statement, I want to know who Julia is. What is her personality? Why she want to be a doctor? What is the motive behind it? And what are the things which motivate her to be a doctor? And how much effort she put in that? I will give you an example. Sometimes, people write in their personal statement their hobbies, which is very good thing. Sure, write it. But put those hobbies where you put an effort on those hobbies. So I was reading, there was a professor from Harvard, and he was telling about the interviews. And I learned one thing from him. He said, once I asked a guy, he put music as his hobby. So you know what he asked the professor? He said, so did you go to Juilliard to
No.
learn music? He said, no. He said, if you cannot put effort on your hobby, how are you going to put effort on your work, right?
Okay.
Like, hobby is something you love, and you did not put any effort in that. How will I take you for this freaking work, which is so difficult? How are you going to put effort in that? So put a hobby where a lot of these kids from India put cricket. Cricket is my hobby. So I always ask them, did you play for your country? Or did you play for your state at least? Did you play for your city? No, I played in my backyard. That's not a hobby. That's not a hobby. So, like you can put in, in your case, just an example, you say, I'm very good with social media. I have my channel and all that. You did effort. So effort is important. I'm focusing a lot on it. We want to know how much effort you're putting the things you do. If you have a hobby and you're not putting an effort in your hobby, I don't know how much effort you will put in your work.
Okay, makes sense. So everything we describe in our personal statement should be explanation of our skills to put an effort to something, okay.
Effort and your personality. Yes, it's about you. And never let anybody else write your personal statement. Never copy personal statement from anywhere. Just write very simple one. We're not looking for state-of-the-art personal statements. We are looking for personal statement.
Yeah.
We want to see individual personal statement. Everybody's personal statement should be different, because no two individuals are same. I have seen so many times same personal statements. I'm telling you, exactly the same person from the internet. And some of them I remember how they start. Don't do that. Just sit down, write 1-page personal statement. Don't write more than 1 page. Nobody goes to the second page. And nobody actually pay attention to your personal statement after second paragraph. So you have to tell about yourself in first 2 paragraphs. That's it. Because there's no time. Yeah, first 2 paragraphs. That's it. You have to say, because that's where, just imagine, just be an interviewer. You an interviewer. And now you have like this big pack of papers when, they give me a file and I'm going through it. And personal statement, of course, we pull it out and I'm reading it. And now I have 10 more documents to see. So I'm going to read the first paragraph, maybe second. That's it. That's it.
Okay.
So I will know from the first paragraph or the second one, what you want to say. I will know if this is taken from the net or something, or you wrote it. Very simple English about you. That's it.
So you think that because a lot of people think that we should, give these documents to professional proofreaders who will enrich those papers with beautiful words and stuff like that. But however, you say that it's more important to express yourself, describe yourself more naturally, right?
We don't need flowery. We need simple. But yes, once you write it, then let somebody American, if possible, to proofread it. That's okay.
Okay.
Yeah, that's okay. You can give it to somebody to proofread it, but don't give it to somebody to write it. You write it because you know who you are. Nobody else. Nobody else. Not even your brothers or sister know who you are.
Doctor, but do you agree with the statement that actually the personal statement is the document which helps program director to understand your personality and also to create some questions to ask you during the interview, like did you go to the music school or stuff like that? So does it work like that? So we should not overestimate personal statements. Is that right?
That's it. Absolutely right. You got it. You got it right. Just you're going to give like some program director some material to start the conversation.
Okay. Okay. Thank you, doctor. And I have one more question regarding this match season. So the interview will be provided online via online services. So what do you think to be the most important part? What should we focus on during the online interview? Because online interaction lacks all this like proper eye contact and this feeling of presence, which makes you understand person better. So what should we focus on?
So first of all, and this is my personal opinion, I think even if you do online interview, I will try to be in US. Try to be in US when you do this interview. That's very, very important. That will give a lot of satisfaction to the program director, especially if you are an IMG and you need visa, you should be in US. If you're sitting somewhere in third world country and interviewing from there, so program director will be very nervous, like, oh man, this guy did not get a visa for an interview. How he gonna get a visa to come here to start residency? That's the biggest challenge that program directors have. I don't know how people will come here. I have no idea. I don't have that answer. But and again, it's my opinion. I think if I'm interviewing somebody and the person is here in US, that will give me confidence that okay, they can do it. Second, when you are giving an interview, it's in person or it's on the phone or is it on this thing, don't worry. You do your best, okay? You give 100% of you. Try to understand what they are saying because, sometimes when you are physically present in front of somebody, it's easy. You don't understand something, you can repeat. But when you're doing this tally, sometimes, as I told you, everybody speak English in their language in US. So sometimes it's very difficult to understand each other. And when you're sitting, in front of somebody, you can ask, okay, please, can you repeat or this? In tele, sometimes, the other person going to ask you a question. Now you're going to be nervous. You're going to be nervous. Like everybody will be nervous a little bit. It's okay to say, sir, I did not get what you said. Can you please repeat? Make sure your phone connection is good. Make sure you have the good internet. Don't do an interview at Starbucks. Make sure you are in a nice place where there's no disturbance, no kids running around, nobody's coming from the back and, say hi, Those
Okay.
So make sure you are in interview state of mind, Just think that it's a real interview. Just think that you are there. Just think and ask as many questions as you want. Answer your question as you are answering while you're present there. So technicality will be a big issue. I'm telling you, like, I'm seeing sometime in our presentations, kids are not able to, show their slides and this and that. So there should not be any issue because, the problem is program director has so many applicants. For every 10 to 15 to 20 spots, they have 200, 300 applicants. If you miss like 2 seconds, you are not connected, internet goes, that's it. Your chance is gone. He has like 10 more people waiting for him. He does not have time. No matter how much, we try later on, sorry, my internet didn't work, this and that. Everybody will say, okay, don't worry about it. But, you got my point, right? So everything counts. Everything counts.
Okay. Thank you, doctor. That's actually very important information for us. And I have the last question regarding the ECFMG certificate. So how do you think will program directors reduce the value of certificate this year, because a lot of people are not able to get it because of the visa restriction and travel restriction. And I understand that, again, scores are the most important thing. However, a lot of people, you know, they just don't understand if they should go for the match without the certificate or they should not. And that's an important question for us.
Right. So you need to tell me a little bit about it. So people who have done CS, they will be CFMG certified, right?
Yeah, right.
But isn't there is an alternative test you can do, that English test?
Yeah, however, you should be either a graduate of some approved medical school, or you should have finished your residency in your home country. And some people just, they don't feel these requirements, or they don't feel these requirements by the time of their deadlines. So will the program directors, you know, like wait for their certificate, or they will just treat these persons as those without certificate?
You should have your certificate by October 21st.
Okay.
Yeah, you should have. Your chance of getting an interview is maximum if you have all the documents ready by the first day of that. If you get that certificate later on, you can apply. I'm not discouraging anybody to not to apply, but try to get all the paperwork done before that. Try to get your certificate in your hand by that date. If you do later, the chances of getting into is really, really low then after that.
Okay.
Whatever the pathway you use, whatever the way you use, try to get all your documents ready by 12. This is not like new. This is age old, you know. That's the residency match. You know, that's one of the worst thing about this match is people who send their applications, even if their scores are low on day one, get more interviews as compared to the ones who have higher scores, but they don't have full documents. That's one of the, I know it's not fair, but you know, that's how system works.
So the documents overweight the scores, right, at this point?
Absolutely. If your documents are not complete, that's another filter. You will be out. Yeah, get it. Try to get it. Again, if you don't have it, then it's okay to apply, but your chance of getting an interview will be less. Try your level best to get every document possible. Try.
Okay. Okay, doctor, thank you. That's actually all my questions. And do you have anything to say, you know, like a final advice, for IMGs at this mesh system?
Okay, so, all right. Now, when you come to US, very important, and this is the most important advice I'm going to give to you guys. Do not take anything lightly. Do not take anything lightly. People judge you on everything. People judge you from your clothes, from your hair, from your makeup, from your way you speak, from the way you behave. Everybody say it doesn't matter, but it matters. Everything matters. For your interview, you buy a new suit, you go to a hairdresser to do your hair done. Nobody wants to see you in messy hair for an interview. Just be at your best behavior. Spend money on your best dress. Spend money on your hair, on your glasses. Everything matters. I'm telling you, everything matters. Everybody say that. No. Face value matters. How you look matters. How clean you look matters. How well dressed are you matters. All those things matters. One score matters once you don't have interview. Once you have an interview, 270, 230, same thing. No difference. Once you have an interview.
Okay.
So then it's you. Then how you make your entry. How you talk to other people. Everybody's watching you over there, okay? So start from the chief resident, residents, you know, coordinators, program directors, everybody giving their inputs. Because it's that one day they're going to give you a job. They want to make sure they are picking the best candidates. You should look pleasant. You should behave pleasant. You should have every document ready. It's not if somebody asks you something like, no, here, you know. Everything should be in order. Try your best to have everything in order. Sometimes things happens, okay, fine, but don't go unprepared. Just go 100% prepared, maybe 200% prepared. After that, if something happens, it's okay. But give your 100%, everything. I'm telling you. Sometimes I see the residents comes in, these poor guys, fly at night. Oh, then they're coming there. Now, car is late, bus is late. And when they come, they're like, That's not the way for an interview. This is your life-changing event. I'm telling you, this gonna change your life forever. I don't care if you have to come a week early, 10 days early. I don't care. You come one day before for an interview. You make yourself comfortable. You have a nice sleep at that night. This is the most important point of your life. Your life is going to change from that day. So you should put every effort on that. I will not, at that point, all your hard work now depends on how you present yourself last day. This is the most important advice I can give you guys. Make sure you guys look good, you guys behave good with everybody, starting from the janitor to the program director. Everybody's watching.
Okay. Thank you, doctor. Thank you very much. So we should not give up. We should try our best, pay attention to any detail because everything matters, and apply to this season.
But one of the best thing about this country is it's a very fair system. If you do all that, you will be successful. That I can tell you, guaranteed.
Okay, doctor, actually that's a nice final phrase for our interview. I cannot overestimate the value of this speech of yours for IMG community, because I guess not only people from Russia but IMGs from all over the world may watch it and pick all this information from our interview, and we appreciate it very much. Thank you that you agreed to participate in it. I appreciate it a lot. Thank you, doctor.
So Thank you, Julia. Thank you, and okay. Namaste.
Okay, bye.
Bye. We will put your link on our website so that people can click from my website and boom, they can see. Is that okay?
That's great, actually.